Morning, everybody. Eric Chaconis here for the PT on Ice Daily Show. I am part of our extremity management team. I created that course about 10 years ago. We have Lindsay Huey and Mark Gallant all over the country now. Let's see. Lindsay, April 9th and 10th is in Santa Rosa, California. And then she is in Bradenton Beach, Florida, April 23rd and 24th. So good for you, Lindsay. Two wonderful locations. And then Mark is going to be May 14th and 15th. He's in Onward, Milwaukee. So if you haven't gotten a chance yet to take extremity management, we are going to be all over the country here in the upcoming months, and then all throughout the summer as well. So it's a great course. 2 days, all things exercise, prescription, manual therapy techniques, lots of progressions for all of the different extremity conditions that might come into your clinic: hip, knee, foot, ankle, shoulder, elbow, wrist, and hand. And so today's topic is somewhat centered around the shoulder and how we can better serve the population of individuals who have are recovering from breast cancer as it pertains to shoulder health. And so, this is a group that really does end up quite oftentimes with a lot of chronic shoulder issues after breast cancer surgery. And so that's what I want to bring to your attention today. I think that this is an underserved population that probably doesn't see they don't see physical therapists enough. We're not seeing those patients enough in our practice. So we've got this publication that just came out, large randomized controlled trial out of the UK. This was sponsored by the National Institute of Health Research out of England. Julie Bruce is the lead author. It's free, open access, full text online. The study is called the Exercise to Prevent Shoulder Problems After Breast Cancer Surgery, the PROSPER RCT. And it'll be in Hump Day Hustling. So if you get our Hump Day Hustling, our weekly newsletter that comes into your email box every Wednesday, it'll be there. If you're not already signed up for Hump Day Hustling, definitely encourage that. It's really easy. Go to ptonice.com, scroll down to the bottom. You can sign up for Hump Day Hustling. And every Wednesday, you will get an email from us with current best evidence, research publications that have come out recently that we believe will help your practice, and other articles and resources and stuff like that. So it's a lot of fun. Definitely, we get great feedback on Hump Day Hustling. All right. So the background here is that when lumpectomy is one of the most common treatments after breast cancer surgery, right? And lumpectomy, where they're removing the tumor from the breast, can oftentimes also be associated with axillary node resection as well. So a lot of times they'll take the lymph nodes out of the axilla when they do the lumpectomy, depending on the stage of the cancer. And what that does, whether they also get radiation postoperatively or not, what that does is oftentimes create mobility restrictions for the shoulder, right? So you can only imagine if you have your axillary region, cut open and they resect those lymph nodes, the likelihood of scar tissue here and the likelihood of scar tissue around the pectoralis major and around the breast is obviously there, right? And so this is just like a total knee replacement. If you get in and see a physical therapist right away after the procedure, the likelihood of you having those complications postoperatively are much lower. And so this is a great study that they did across England. They looked at 17 different breast cancer centers, treatment centers, and they ended up enrolling 392 individuals. So they took that group, that 392, and they randomized them to two groups. So one group got kind of standard of care, just a leaflet, an educational flyer. Here are some exercises you should do. Here's how to take care of yourself right after this procedure. And the other group was randomized into a progressive exercise program that was conducted by a physiotherapist. And so they saw a physiotherapist right at 1 week. So in the 7 to 10 day postoperative time. And then they also saw them again at 16 weeks. They gave us something at 6 weeks and then 16 weeks. So like week 1, you figure then about, the 2.5 month mark ish, and then, or the 1.5 month mark ish, and then the 4 month mark. And so, so it was only 3 to 6 visits total, right? For this group. And it's a lot of overhead mobility work, getting them up above 90. The restriction most oftentimes is with elevation, external rotation, and abduction. So really getting up into that overhead position is very challenging for these individuals because of all that restriction, right? And so that was the focus early on. That first visit's very much a mobility focused visit. And then they did a progressive strengthening program, lots of loaded overhead work, lots of cuff work and shoulder girdle progressive strengthening. Little bit of manual therapy, and then some behavioral education stuff, right? Lifestyle behavioral education, and really a lot of education on how to care for the wound and how to care for the limb to prevent lymphedema and stuff like that. So very standard progressive program, right? After the procedure. And what they found is that at, function measured by the DASH, pain scores, all of those scores that you would typically measure in a shoulder trial like that, all improved, especially in the short term. So when you look at pain, particularly 6 weeks, 12 weeks, like even up to 6 months, the group that got the exercise program did better, right? They had less pain. At 1 year out, the pain scores tended to level out. And you figure for most people at 1 year, maybe pain in the region is not as common, right? Because the healing process has occurred. But what's interesting is when you looked at quality of life and cost, the group that saw the physiotherapist actually had higher quality of life scores and actually spent less in healthcare costs. So over time, that group utilized less healthcare. And it's hard to get in the weeds of what that looked like, where the spend was. They didn't really describe that too well. But the bottom line is they had less follow-up visits, spent less money in the year after the surgical procedure. And so you wonder, right, maybe because of less complications and less need for further follow-up because it kind of all got nipped. They took care of it early on, which is really key. So that's my big thing is you have to look at this just like it's a total knee. And these individuals need to be seen right away, post-operatively. It should not be reserved. Physical therapy should not be reserved for the complicated cases. Usually that's the case, what you see right now. A good breast surgeon, a good medical oncologist is probably going to refer early and often. Great centers, when you look like where I live in Northeast Florida, at Gainesville, at Shands, it's a big breast center. It's kind of standard that the physical therapist is a member of the breast cancer team, right? And so they're used to referring. But when you look at a lot of these across the United States in a lot of places, that is not common. I mean, it should be, but it's not the standard of care, right? And that's what we're advocating for here. So anyway, it prevents axillary web syndrome. Axillary web syndrome is one of the most severe scenarios where you have a lot of scar tissue in the axilla and you have significant pain and inability to reach overhead. Getting in there early like that certainly helps with that. And so, I think that's just the key is mobilizing that shoulder, getting them used to being in an overhead position and starting to load it while healing is occurring for better long-term functional outcomes is really what it's all about. And so anyway, I think if you are looking to serve a population in your practice, this is a key population to target. I think going and meeting with your local breast surgeon, going and meeting with your local medical oncologist to see how you can serve their patients is a great play. And you're certainly doing a big service to the community. You can go for a diagnosis like breast cancer. Most communities have a breast cancer support group. Going to that group and speaking and educating them on what you provide as a physical therapist, that's a great strategy as well. And then, of course, you have the APTA Oncology, the Academy of Oncology. So, if you're looking for resources and professional community where other individuals are specializing and seeing this population of patients, that's a great option as well. So hope that helps, give you some more ideas, a new population that we can serve, and have a great day. Take care, everybody.